Another To Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the To Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your dental health, and do subscribe to our YouTube channel to get your updates. And today, in conversation with me on the To Talk is Dr. Anupama Savadi. To give you a brief introduction about Dr. Anupama, Dr. Anupama Savadi is a practicing dentist with over 19 years of experience in the field of orthodontics. She's a graduate from the GEC Bangalore. She completed her UG and PG from the prestigious Government Dental College in Bangalore. Dr. Anupama was given the Indira Mrityunjaya Award for scoring highest marks in orthodontics in her BDS. Passing out of her PG in the year 2001, Dr. Anupama has since worked in the field of orthodontics as a private practitioner and a teacher. She is currently a professor at the Department of Orthodontics, Sri Venkateshwara Dental College, Bangalore. Dr. Anupama, with her husband, Dr. Ravindra Savadi, practices at Savadi Dental Care. Dr. Anupama is actively involved with the Rotary Club in contributing to social services. A trained Bharatanatyam dancer and a lovely mother of two, Dr. Anupama celebrates her passion for dentistry with her other interests. Good morning, Dr. Anupama. Thank you so much for joining me in today's To Talk with Your Dentist conversation.
Good morning, Dr. Rekha, and good morning to everyone who is listening to the talk. Yeah?
Yes. So, Dr. Anupama, your field of specialty within dentistry is orthodontics. Orthodontics are something that deals with the bone, the structures, the hard structures of the teeth. So, what exactly is this branch of dentistry?
See that this branch of orthodontic deals with any correction of teeth alignment and even the surrounding bone and the supporting structures. So, as you see, if someone tells orthodontic or braces, they feel generally it's only about one's teeth and all is irregular. You put the braces and you correct the teeth. That's not the only point. We start seeing at a very young age, we see the growth of the bones. Are the maxilla, the upper jaw, lower jaw in harmony? Are they growing, in harmony to each other and in balance? Whether all the teeth, milk teeth are, exfoliating or falling down at the right time, and whether the permanent teeth are erupting. Then comes the correction of teeth. Sometimes correction of teeth is not itself completely whole or sufficient on its own. We require something called surgical orthodontics or periodontal treatment, some surgery, like that. Orthodontics is a wide field and area. It's not only just about correction of teeth with braces.
Yes. So the part which involves correction of teeth probably starts off from a much younger age, as opposed to when patients actually come to us with just a teeth correction.
Yeah. See, the idea most of the times when I've seen patients with really crowded teeth or teeth that are way off the mark, some of them tell that initially they did visit a general practitioner or a general dentist, and they were advised to visit only when they were 12, 13 years, or when they had the whole set complement of teeth. Sometimes if there is an irregularity in the bone, we have lost so much of time and growth. So though we tell orthodontic treatment when all the permanent teeth come, sometimes there is two phases of orthodontic treatment, like phase 1 and phase 2. When there are cross bites or some other problems, we will have to put braces in the phase 1 orthodontic treatment, relieve the cross bite, allow for proper growth, and then go for phase 2 orthodontic treatment when they have the complete set of permanent teeth. Or if we see at a younger age, very narrow V-shaped maxilla, it's like this. Generally, we would like the curvature of the maxilla to be U, enough space, intraoral space for the tongue, speech and all that. So if they have narrow maxilla, we can do something called as rapid maxillary expansion, functional appliances. So it's not wise to always wait till 13 years. If you are on the lucky side, then you might just require about correction of teeth, but all of them do not fall under it. Yeah. Voice is not clear, Rekha.
Sorry, I had to put my mute. So, in that case, doctor, what do you think? What would you suggest our patients is the right age to take the child to see an orthodontist, or what are the signs that the patient, the parent should notice and take it seriously and take the child to see an orthodontist who would probably start off with this phase one correction, which is a growth correction phase of the treatment.
See, generally, we would advise even when they have few milk teeth in their mouth to visit a dentist. They might not require any big treatment, just visit the dentist. If something is wrong, like most of the patient in the age of, pre-KG, nursery, first, second, and third standard might have abnormal habits like thumb sucking, tongue thrusting, or it might be in crossbite. The anterior milk teeth might be in crossbite, the posterior milk teeth might be in crossbite. So we can identify what is wrong. And now we are creating awareness among all.
If I can just interrupt, I think crossbite is a very technical term. So if you can just tell our patients what exactly a crossbite is, what is it that they should notice is not normal?
Yeah. See, when I bite like this, if I can show in my fingers, this is the maxillary teeth, this is the mandibular. The maxillary teeth is at the overjet, they are overlapping, and there is a space between upper and lower teeth.
That means the upper tooth is outside the lower tooth.
Yes. So now what happens in crossbite, it is like this. The mandibular teeth is overlapping the maxillary. What happens now? The growth of the maxilla, the upper jaw becomes hampered, limited, and the mandibular growth takes over, especially if they have a predominant genetic factor. So yeah, sometimes just elimination of the crossbite at that particular time when the child is young might allow for proper growth. If they are genetically predominant, then we need to see them at every growth spurt, which of course the orthodontist will decide.
Yes. So, Dr. Anupama, what exactly is this growth spurt phase? Between what ages does the growth spurt fall into? Where the patients have to actually take care and take action and rectify any correction that would be needed.
See, 3 years, 5 years, then comes 10. For some people, it's 12, 13, then 16, 18 for some boys. So it is like every patient, it is different, but these are the main ages that you have to concentrate on. Yes.
Okay, so that means these are the ages, more or less, the patients have to be aware that there would be some growth changes that will be happening in the child's mouth, and these are the times as doctors we can take advantage of this to make any corrections that is possible. Okay,
yes.
So Dr. Anupama, so who do you think is an ideal candidate to get a clip treatment done? I think this
who is the
ideal candidate, means who is a patient who would ideally qualify for a clip treatment. I think a lot of people come and ask, slightly, like we said, during growth spurt is the time when we do corrections. But unfortunately, maybe for some of them, they would have not had the opportunity, or they would not be aware and they would have missed that age. So there are a lot of people who are much older who try to seek a treatment. So are these people also eligible for a clip treatment?
Yeah. See, that is the main important thing. I have seen so many adult patients who are like, if they have finished their graduation, if they are married, they think life is like over. Okay, I'm married now, this is okay. No, adult orthodontics is a big field. If you have good periodontal ligament, if the bone is good, you can always get your orthodontic treatment done. I had an adult female patient who really had protruded teeth, spacing between the teeth, and she was very conscious to smile. So she came when she was in her late 30s. And then she even agreed not only for closure of spaces, for extraction of the first premolar on all the 4 sides, taking the teeth back. So I asked her, why didn't you get this done before? So you could have enjoyed the smile from a very young age. She told, no, doctor, my parents were of the idea that it is okay as it is. Then one day I was watching this movie where I saw this actress. She just, turned her head and she smiled. She flashed such a good smile. So I really wanted a smile like that. So motivation and inspiration can come from anyone and anywhere. Anyway, she went on to get a very good smile, and she's extremely glad that she took treatment at a later stage, but nevertheless she took it.
So I think it becomes more important that parents are aware, and they are motivated to take their children to visit the dentist. So I keep telling in all my talks and all to my patients also that visit your dentist at least once in 4 months, because if we say 4 months, probably that would get a little more extended. So I think once in 4 months, you take your you yourself go take your children. If you are, if you have children, take them for probably some routine checkups. Because I think at every stage there is something that does get detected.
See, at least I would advise, whatever your busy schedule, I think the children are more busy than the adults. They go to every other class. If my orthodontic patient is coming, they tell Monday, Wednesday, Friday, I have tutorials. Then Tuesday and Thursday, I have drawing class, then sports. I'm like, when are you free? And orthodontic check is like only once in a month. Okay.
Yeah.
So,
Yeah.
whatever your busy schedule, I would advise you to come at least once in a year, if even for a general checkup, if you're not an orthodontic treatment. But at the time when your teeth are erupting, like the permanent teeth, see, at 7 years, you have the four central, two central, two lateral, again the lower incisors. That is one age where you have to be cautious about at around 6-7 years, when these permanent incisors are erupting. And then later on, at the age of again 11, 12, 13 years, when your premolars, molars, canines erupt. So at that stage, I would advise more frequent checkup once in 3-4 months, so that we see whether the teeth are following a normal timetable. What I would advise is, if the canine comes on the right upper side, I would want all the other canines to come on this 6-month timetable. Otherwise, we have to intervene. So that is the rule. I would advise 1 year checkup if everything is normal. At the stage when they are having eruption of permanent teeth, a frequent 3-4 months, once in 3-4 months checkup. Yeah.
So again, I think that is the key. I think the key again is the motivation. The patients should understand that some things are rectifiable at a much earlier age, and it's not that as adults you are not eligible to get your clip treatment done. You can get it done. Of course, there would probably be some limitations to the amount of correction that can be done. But nonetheless, doctor, that means to say that if you have a strong bone and a healthy gum, clip treatment to an extent is still possible even in adult patients.
Yeah, see, suppose in a younger patient, if the maxilla is growing more rapidly, or they have a very prominent maxilla, we can promote the growth of the mandible with functional appliance. When it is an adult patient, correction of teeth is possible by orthodontic treatment, but we have lost on the growth. But nevertheless, surgical treatment is so much advanced, and there is so plenty of treatment. Even if you have a very prominent maxilla, now you can have a maxillary setback and a mandibular advancement, combination surgeries. So along with surgery and orthodontic treatment, you can get a very good result if you are suitable for it. Yes.
Exactly. So which means to say that individual patient evaluation would be required, and as per case, we have to take the treatment forward. So
Yes.
I think Dr. Anupama, I think orthodontics is such a wide field within dentistry itself. I think there is so much, right from when the child is born to when the jaw growth happens till much later date. Every field, every related field in dentistry, of course, they are all interrelated. Although we would separate them and say that each of them is one. But I think orthodontics by itself is such a vast field. And we did cover, I think, a very small topic today, almost like a very brief introduction kind of a thing. I was just hoping that, I can get you back on the series to do more talks and tell our patients more about the advanced treatment options that are available to them as on today's date.
Yes, definitely. As the saying goes, no, smile is the curve that sets everything right. Okay. And being an orthodontist, I'm so happy and proud to have that privilege of giving treatment to the patients. Definitely we can enumerate the details and various treatment options in all the future talks. That would be really nice.
So, thank you so much for joining me today, Dr. Anupama, and I really hope to get you back again.
Thanks, Dr. Rekha, for giving me this opportunity. I'm really grateful. Thanks a lot. All of you have a nice day.
Viewers, that was Dr. Anupama Savadi, who did talk to us about the importance of clip treatment and who is eligible or who is the ideal candidate for a clip treatment. And I hope to get her back to give more talks on this field in dentistry. So until next time, I come back with another dentist with another topic on the Tooth Talk with your dentist. Keep smiling and be happy. Thank you.